everyone. We have just gotten some breaking news that Humira, the wonder drug of the century, has finally received approval from the FDA for use in inflammatory diseases. But what exactly is Humira? How does it work? And what is the big deal about it? We're here today with a group of principal scientists from the BASF Pharma who have played a key role in the discovery of Humira. They're going to explain to us what this prescription drug is, its mechanisms, dosage information, side effects, history development, and finally, some recent news about patenting and biosimilars. We'll hear from Connie.
What is Humira? Adalimumab, sold under the brand name Humira, is an anti-TNF-alpha monoclonal antibody prescription medication administered by injection under the skin. It is a protein made by blood cells to support the immune system. Humira is a tumor necrosis factor TNF-alpha blocker that blocks the activity of TNF, a substance in the body that can cause inflammation and lead to inflammatory diseases such as Crohn's disease and rheumatoid arthritis. Humira contains the active drug adalimumab, a biologic medication made from living cells. Humira is now an FDA-approved prescription medication used to treat several conditions that play a role in inflammation, including rheumatoid arthritis, Crohn's disease, psoriatic arthritis, and plaque psoriasis. To understand how Humira works, it is important to understand what tumor necrosis factors are. Tumor necrosis factor, TNF, is a naturally occurring cytokine associated with inflammation in the skin, joints, and gastrointestinal tract, and is produced by white blood cells in response to antigens or infections, indicating that the immune system is healthy and working. TNF-alpha circulates in the blood during the natural healing process, creating inflammation to allow that area of the body to heal. TNF-alpha triggers the production of immune system molecules such as interleukin-1 and interleukin-6, both of which destroy cartilage and bone, driving even more inflammation. Elevated levels of TNF may lead to excessive inflammation, where too much TNF may damage and attack normal, healthy body tissues. TNF inhibitors such as Humira are drugs that stop inflammation and are used to treat inflammatory conditions. Humira binds to TNF and blocks TNF receptor interactions. In healthy individuals, excess levels of TNF in the blood are blocked naturally. But for those with rheumatic or autoimmune conditions, high levels of TNF in the blood will lead to increased inflammation. Humira recognizes and binds to TNF-alpha present at increased levels in those with inflammatory conditions to neutralize TNF-alpha bioactivity and neutralize the function of TNF by blocking its interactions with the cell surface TNF receptors and inducing apoptosis of TNF-expressing cells.
While Humira seems perfectly amazing, it does not come without its problems. Like any medication, from old-fashioned patent medicines to modern biologics, Humira has a host of side effects. This does contain the basics, such as allergic reactions, but can be more severe. Primarily, those taking Humira are warned that the medication can lead to a weakened immune system, which leads to a higher risk of infection, one of the primary warnings being for respiratory diseases like tuberculosis. Use has also been linked to increased incidence of cancers like lymphoma. Similar TNF-alpha blockers have been linked to possible heart diseases such as congestive heart failure, or CVT, though Humira has not been reported with incidence of CVT. As of a paper by Scheinfeld in 2005, it still contains this warning. Other risks include developing lupus-like disease. Similar drugs have produced demyelinating diseases, and even immunogenicity, in which case the body creates antibodies against this antibody medication. We can also take a look at the history and development of Humira. Humira, or adalimumab, because drug makers like to make things complicated, was initially created by BASF Pharma, commissioning Cambridge antibody technology. After rigorous testing and research, it was FDA approved in 2002 for the treatment of rheumatoid arthritis. According to a feature article in Biospace by Glasher in 2018, the name is intended to stand for Human Monoclonal Antibody in Rheumatoid Arthritis, which is what it was initially designed to treat. It has since expanded to treat several other conditions, including Crohn's disease, ankylosing spondylitis, psoriatic arthritis, and plaque psoriasis, an autoimmune skin condition.
Thank you for all of that information. As you can see, Humira can help with a multitude of illnesses. The dosage of Humira depends on several factors, including the type and severity of the condition, age, the form of Humira to be taken, other medical conditions, and body weight for children. For a drug so incredible, one would think that anyone who could take it would. Unfortunately, not everyone has access to this wonder drug. Now, this is my first major story, so I've done a little extra digging to find out more about AbbVie, the company behind Humira. Humira is manufactured by AbbVie, a pharmaceutical company. They have been one of the sole manufacturers and distributors for a long time, but it's due to their patent regulation. AbbVie applied to patents that maintain the rights to Humira for 20 years. This means that other people don't have the ability to use the chemical formula or the process that Humira needs to create the drug. Although this patent was going to expire, Humira expanded on patents. The way to do this is by changing what the chemical can do in their patent information. For example, if they say Humira treats ankylosing spondylitis, they can instead say 40 milligrams of Humira is a way to treat ankylosing spondylitis. This slight word change gives them the rights to a new patent and allows them to extend the time that they have control over the drug. Let's hear from another insider source to learn more about biosimilar drugs and what Humira has done and continues to do to make sure these stay off the market.
Pharmaceutical monopoly doesn't sound as fun as the board game Monopoly. And to combat this kind of monopoly, several companies have developed biosimilars for Humira, which are less expensive versions of the drug and designed to be interchangeable with the original product. These biosimilars are subject to the same rigorous testing and approval process as Humira and must demonstrate that they are just as safe and effective as Humira. Biosimilar drugs must also have a similar structure to the reference compound and must be clinically proven to have similar or identical effects, if not improved effects, to the original compound Humira. Amjevita, produced by Amgen, is currently the only Humira biosimilar drug on the market in the US. Currently, they have a 6-month exclusivity deal, which was just announced in January of 2023, which gives Amjevita exclusive rights to be the only biosimilar for Humira on the market for 6 months. In July of 2023, 6 new other biosimilars will be available on the market for Humira in the US. Initially, Humira's patent was to be expired in 2016. However, it was extended to 2032 because they were able to generate new patents under manufacturing and administering the drug. For patients who require this kind of drug in Europe, they have more access to certain biosimilars such as Seletso and Hirames, which will also be available in the US in July of 2023 with 4 other biosimilars.